Your Misinformation is part of the Demcast family of podcasts. What's up, everybody? I'm Katie.
And I'm Morgan.
And this is For Your Misinformation, a podcast dedicated to empowering women to be more politically engaged so we can act in our own best interests.
Let us break down the problem and tell you what we're doing and what you can do to help solve it.
Hi, everybody. It's Katie. I am here without Morgan this week. There are, if you're listening to this the day it comes out, there are 57 days till the election, or 8 weeks, however you prefer to think about it. So I don't care what you're doing right now to make sure that Joe Biden gets elected, but make sure that you are doing something. And we will definitely talk about some of the options at the end of this episode. I'm very excited this week because I am joined by Mark Spencer, who is an internal medicine resident in Atlanta, who has a really unique perspective about the prison industrial complex, which I know I needed to understand better, and what healthcare and Medicare for All has to do with it. So, hi, Mark. How are you doing today?
Hey, Katie. Thanks for having me. I'm doing well. It's my first time doing this kind of thing. So hopefully everyone will just bear with me. But,
yeah, no pressure. So usually I start out by asking people how we know each other. So do you remember the first time we met or how we met?
Yeah.
No, you don't.
In high school.
Okay, yes. So we, I don't remember either. To everybody, Mark is my friend's little brother, but now he's a doctor, and he's going to explain some really complicated stuff to us. But we also, I believe, have a bond as college athletes, right? Didn't you play soccer in college?
I did, yeah. Not very well, but I did try.
So Morgan was also a college athlete, but not a Division III college athlete. So we have like even a more specific bond than her. So
nice.
Yes. Okay. You wrote a paper about, well, I guess I just explained it. And thank you for letting me read it. It seems like you are pretty disappointed, to put it mildly, in like our current healthcare and prison systems, but you kind of see COVID as like an opportunity to abolish what we currently have and like build more equitable systems in its place. Does that sound right?
Yeah, I think that's maybe a good summary. And it's all very complicated and also new to me. So just kind of, disclaimer up front. I'm not like an expert or spokesperson for like anything like abolitionist or really knowledge on like the prison industrial complex. Like obviously my background is in like medicine, and I don't really even consider myself an expert in that. So that's just to say that over the past few years, kind of like you're saying, Katie, I've kind of come to see how detrimental our prison and policing system is to healthcare in the US and kind of the interactions between the two systems. And I guess for lack of a better term, like the losers of like our healthcare system, the people that don't have access, that have trouble, finding care, affording things, are the same people that are often swept up in the prison industrial complex, being, disproportionately, overwhelmingly poor people, people of color, gender nonconforming people, LGBTQ, especially trans people, who like our healthcare system does a really miserable job at, and are dramatically affected by prison industrial complex. So there's just a lot of overlap, and then it's not something that we learn about or hear about like even at all in medicine and medical school. Really in undergrad or anything. I think being obviously like a white privileged male, it's just kind of this concept that I've heard about and learned about incorrectly through like movies and popular culture, and this whole idea of like crime and violence and what our criminal legal system is and does for us, and like that it keeps us safe, and all of this, and obviously we all grew up in a generation of parents who were surrounded by like this like rah law and order politics of like the 70s 80s, which is making like a comeback now in 2020. So anyways, that's a long answer to say that I'm new to this, and I think what's frustrating is that It's just that like I had zero exposure to it, no understanding of it, and that like we're pretty much okay with just disappearing massive amounts of people into prisons and jails. Um, and yeah, it's pretty messed up and has detrimental impacts to like their healthcare, but also, you know, our society's health systems in general.
Okay, you mentioned that you don't feel like an expert, and that is kind of how I feel. I also don't feel like I'm really an expert on like anything, but I hope to be good at explaining perspectives, like how people should be framing problems. And I think that is what you are pretty good at doing too. And after reading your paper, it seems like you're pretty good at communicating it also, which is a different but also important piece of the puzzle. Um, so yeah, um, I okay. Speaking of like all these different systems like interacting to impact all the same people who just get a deluge of it. Morgan and I, we met because at a job interview, I hired her to work in the health promotion division of a local health department. And my job, or a big part of my job, was to write the community health needs assessment every 3 years. And that's part of the Affordable Care Act, actually. But I made it through like 1.5 cycles, and I just could tell already that it was going to be the same no matter what. Like, why are we bothering? Like, behavioral health is an issue, access to healthcare is an issue, obesity is an issue. Like, I'm tired of, and we also had like really disproportionately high asthma rates in this one zip code. So we got like a grant from the state to work on, this is just like one small example, but got a grant from the state to work on asthma rates there. But I just got really tired of that. And at one point, like brought up to the rest of the steering committee was like, could we talk about housing as one of our main, like one of the top 3 things that we're going to work on instead of like obesity? Like, or could we talk about like broadening it even to like poverty? And all the old people were like, no, we can't do that. And it's like, okay, well, fine. But it's just like, as a society, we think so much about treatment when it's much cheaper and less traumatic and just all around better to talk about prevention. So that, I don't know, that's how I think about what you are talking about with Medicare for All doing a lot to help with the prison industrial complex. Because I think the scariest stat that I read in your paper was that LA County Prison, Rikers Island, and Cook County Jail were the top 3 mental health providers in the country.
Yeah.
And yeah, that is terrifying. And that's a disability. Like, mental health problems are disability, they're invisible disabilities. So, yes, people are with disabilities are disproportionately affected by all of this stuff as well.
Yeah, I think you bring up a lot of actually really good points right there. But one of them just being kind of that like not obviously none of this shit like happens in a silo, right? Like
Mm-hmm.
this is why um, you know, it's surprising that we don't hear about incarceration and that like obviously is detrimentally impacting the same communities that like all of our medical institutions and hospitals are, you know, really claiming to serve. And it's like, oh, we, you know, care about, you know, the quote unquote like under resourced, like under, you know, served, marginalized, vulnerable. Um, and then our healthcare system is actually not built to like provide for them. And then we also, you know, are actively stomping on them and their well-being with the prison industrial complex. Um, and that's just to say that's like 2 systems of many, right? But yeah, like you can't talk about healthcare without talking about like systemic poverty. You can't talk about healthcare without talking about like housing inequality, like environmental justice, environmental racism, all these things.
Mm-hmm.
And I think that's, you know, encouragingly a lot of people coming through medical school now have that kind of lens and analysis, but historically it's really not the case. And it was kind of like my job is to, you know, write a prescription, and if, you know, you don't follow it, then you're quote unquote non-compliant. um, but really, you know, that's just a really resounding failure of our healthcare system and like recognizing what like health is.
Yeah.
um, yeah.
Yes. Not just the absence of disease. They like drill that into your head when you're studying public health.
Yeah, I think like, and I'm sure you know these things being in public health background. We like this is like often quoted like statistics of being like 80 to 90% of our health is driven by like the social determinants of health
Hmm.
being like all these factors we're talking about, and
Yeah.
then like 10% is like the explicit job of like being a doctor, which
Yeah.
is like very little. So it's like we should be incorporating much more of this analysis, um, into everything we do.
Yes. I'm so glad to hear you bring up the social determinants of health because that is, I don't even know if Morgan knows this, but that is the question during her interview when I was like, okay, like she's hired because she was so
Yeah.
good at explaining like what they mean and how they impact people. But to anybody who's like not familiar, they're just like the conditions in which people are born and then grow, live, work, age, do everything. Like your socioeconomic status, your education, the neighborhood you grow up in, whether it's like safe to go for a jog or not, um, your physical environment, your employment, like social support networks, whether you're lonely or not, all of that stuff, like access to healthcare, all of that stuff is a social determinant of health. And basically, if like your zip code is a much better predictor of your life expectancy and your health outcomes during your life than like your genetic code is. It's much more impacted by the social determinants of health, which yeah is gonna, as a society we're gonna have to understand health differently and much more broadly. But I think we're, I mean, we have no choice. Like we have to. So I think we're on the way there. Um,
Yeah. And
yeah.
I think, we'll get there, I think, a little later on, but that idea and just concept of like social determinants of health is just super important when you talk about like alternatives and solutions or whatever. Basically, a lot of like the abolitionists that I've kind of learned about and grown to really respect, and that in a lot of ways I think I've learned more more about and been more inspired by them. A lot of higher education in the U.S.
Yeah.
Being like Miriam Kaba and like Ruth Wilson Gilmore and Angela Davis, um, all of these Black women um, that just are honestly super inspired, and they talk a lot about just like envisioning a different world and what that
Mm-hmm.
could look like. Um, and like none of that involves really like tinkering around the edges or like
Yes.
working with the systems that we have. Like we acknowledge that like the systems we have are fucked up and broken, so like we need to radically reimagine things and like
Right.
um
Which is, can I bring up, okay, I want to bring up what centrists, like that is the main thing that bothers me, especially when like, I think you put in your email that like people typically with like your background don't end up at like becoming abolitionists usually. Um, but um, I feel like I talk to so many, I don't know, white guys in their mid 20s, sorry, who are like, well, like I don't want to be too drastic. Like they think that the answer is whatever's midway between group A and group B, and like right now group A and group B are both so far like from the from anything. Like if group A is the Republicans and they're pro police all the way, law and order, and the Democrats are like, maybe let's shift fund. It's like, no, I'm not interested. Like the right answer is not like whatever is equidistant between like full funding of the police and like cutting it by 15% or whatever the Democrat. Like I
mhm.
don't know. I don't even know what the like more conservative Democrats want to do about that. But I promise, whatever it is, it's inadequate. Um, so yeah, that I have such a I get so annoyed. I have no patience for centrists who are just like, let's just do whatever's in the middle. And it's like, but you have a fundamental misunderstanding of what the problem is. So like, let's talk about that, and then we can talk about solving it because what neither of these options are that.
Yeah, I think, and it's kind of funny, right? Because like if you watch like the RNC,
I
they're
did
just
not.
paint they paint. I didn't either, but you see the Twitter highlights, which is
Yeah.
good enough. And then, they really paint this like socialist, like utopian view of like Biden's administration, which is just like not even close. Like I mean, Biden like has said he wants to add $300 million to like the policing budget. So like in no world are like either administrations like actually talking about like defunding the police or
Yes.
really like shaking up like incarceration. Like I think like, you know, you and like talking about, you know, like the white whatever moderate male guy or whoever, right? I mean, most of it's just like a total lack of like understanding, right?
Mm-hmm.
But everyone has a hot take, and that's why it's, you know, kind of like hypocritical that I'm the one here talking about these things.
Yeah.
But really only like for, you know, to hopefully expose people to different you know,
I think
ideas
you
and people
have to
to then go
stop.
read. But yeah,
But people, the people that you're trying to influence or are are reaching are not reading Angela Davis, but they might come to Angela Davis through you. So like you are a very important link and piece in this puzzle also, and you should stop um, stop pretending like you're not. Um, okay.
fair enough.
In your paper, you talked about how like divorced are these systems are from like evidence-based medicine or evidence-based programming, and like that too, I don't know, just makes me mad because there are answers out there to a lot of these things. I mean, you just have to look to other countries to see what kind of stuff they've implemented and has worked. And it's so frustrating pretending like that like information isn't out there. Um, but do you want to talk just like about how like super cruel prisons are? Like, I mean, I guess policing in general is like extremely cruel, but like we've made the point on this podcast about defunding the police, but the next logical step is then abolition. Um, but
Yeah,
let's talk
I
about
think
like how cruel like prisons are and why they have to go.
Yeah, I think it's a lot to unpack there, but I think again you're touching on a lot of important things I want to cover. One being that you can't divorce policing from prisons and jails, right? And so like police, I mean, police is essentially policing in America is a state sanctioned like military force, right? Like to like job is really to like protect the interests of like the white elite and like you know their job is essentially to fill prisons, right? Like they are the ones that
Mm-hmm.
funnel
Yeah.
people who we deem undesirable or like annoying to whoever, and we put them in cages because that's more convenient, um, you know, than giving a dollar bill to a homeless person or something like that. So yeah, I mean, they're one and the same entity, right? Like the prison industrial complex. I think it would have been helpful maybe to just like give a definition. And
Sure.
I like the definition by like Critical Resistance, who's you know, an abolitionist organization that started at the end of the 90s,
Mm-hmm.
with a lot of the people that I was naming earlier, like Angela Davis and many others. But you know, they basically use a short definition, meaning the prison industrial complex is the overlapping interests of government and industry that use surveillance, policing, and imprisonment as solutions to economic, social, and political problems. So that's kind of what we're talking about. And like when you talk about abolition, at least in my understanding, you know, that's what it is. And there's a lot of conversations right now about defunding and the language we're using. But you know, it's to be very clear, like, you know, if you want to be an abolitionist, or if you know, if you believe in their ideas, if you believe in their vision, that's what it is. It means like the institutions of policing, prisons, and surveillance that exist today no longer exist, which includes, you know, parole, which includes probation, which includes a lot of the other like carceral institutions that we have, which, you know, involve, I mean, police again, like in schools, whether they're under a different name, police in hospitals, like hospitals are also like very carceral institutions right now, because like our imaginations are so bad that like we can't think of a different way to meet someone in a emergency room in like a mental health crisis, right? Like our only idea is like we need to use like physical or chemical restraints. Like there's even in the hospital, like we just have such poor imagination in like how to treat like human beings that have needs. So that is exactly what it means. And I think when they talk about defunding, that's also exactly what they mean. So it's kind of funny to see a lot of like analysis about, well, what do they really mean by defunding? It's like, it's actually in some ways very simple, right? Like it's
Mm-hmm.
like, that like abolition is like, that's kind of the easier part, or the easy thing to imagine, is like these institutions don't exist. But obviously like nothing happens in like a vacuum, and like the bigger part of it is that it's also very much a positive project, right? It's like
Mm-hmm.
about the tearing down of these like life destroying institutions, and like the building up of like life affirming institutions,
Mm-hmm.
which is to say like, how do we actually meet people's needs, and how do we actually reduce like harm and violence from happening? So that involves providing housing, like all these other things, and I think we'll
Mm-hmm.
get to that. But I'm gonna try to answer what you were asking me the first time, which is basically like, what are prisons like? Which I have never been in one. I've never been arrested. um, Cops generally have treated me like fairly well um, in my very limited interactions, which probably has a lot to do with what I look like.
Mm-hmm.
And so all of this has kind of come from reading, just reading and trying to listen, which I think is probably the biggest lesson um, that I would hope to encourage of anyone who's interested in these topics, is just to listen to the people most affected by it,
Yes,
and like the
please give
active.
us book recs at the end for sure, and
Yeah, for sure. And
videos.
just like, yeah, just like activists and organizers that have been doing this work for decades, and like um, abolition and all these organizations, like none of this is new, right? Like defunding the police is new to a lot of people from 3 months ago, but
Mm-hmm.
like these movements have been around since prisons have been around. um, so that being said, I think one point that drew me to kind of this topic and wanting to understand more about the healthcare in prisons um, was just seeing how honestly cruel that they are, and reading about that, and just seeing like, it's almost seemed like unbelievable to me that it
Mm-hmm.
was like happening, which maybe is super naive.
Uh,
But yeah, I think like, and I think if you just think about it, uh, we're seeing police murder people in broad daylight, right? Because there's zero accountability, zero oversight. And so like, just logically extrapolating that, like, what do you think is honestly really going on behind bars, right? And like, they're these institutions are just incredibly violent,
mm-hmm.
like beyond like imagination. Like, there's no aspect of like, meeting someone's needs behind jail. And this idea that like prisons are like rehabilitative is just like so far from like what they could possibly be, because like at their core they're violent
Mm-hmm.
institutions where like physical violence, sexual violence thrive, whether that's between inmates or like often meted out by like correctional
Mm-hmm.
officers, right? Like this like drug use is obviously happening there, right? Like this, which is not in it in itself a problem, but like this idea that like, oh, like we'll put people in jail and then like you're not exposed to like your vices and we're
Mm-hmm.
helping you, like even that is just untrue, right? And like, again, like oftentimes that is coming in by the correctional officers, right? Like
Yeah.
this staff like that is there taking care of people that often have like a ton of needs, right? And have lived like very traumatic lives,
Mm-hmm.
like overwhelmingly like low income, possibly dealing with like houselessness, possibly dealing with like also mental health, untreated,
Yeah.
more than likely, given our just like complete lack of like infrastructure, often also dealing with comorbid like substance use disorders, like all of those things wrapped in one. And then we have like these correctional officers whose only tool, similar to policing in the community, is violence, right? Like they
Mm-hmm.
don't know what to do with like these people. They don't know how to meet their needs, and they're not really interested in that. And like, that might sound harsh, but that's just honestly the institution, right? And this kind of gets at the idea of like, is people being bad people or institutions being bad institutions. And like, there's not really such thing as like the quote unquote good cop or the quote unquote positive correctional officer, um, because you work for an evil destructive institutions,
Right.
and that's kind of you know the truth. um, so I think the violence is definitely something that like you can't understate.
Yeah. Well,
That.
even like, there was an example about a judge ordering like no like complete um I'm butchering
Yeah,
this,
yeah,
but
I know what you're getting at. Yeah, so I think, yeah, I know I veer off topic a lot, but
no, it's okay.
related to your question just about healthcare not following evidence-based medicine. So
Mm-hmm.
um, yeah, like the one thing is just that these places are awful places to be. They're overcrowded. They're dirty. They're, you know, COVID's going on and they don't
Mm-hmm.
have, you know, proper sanitation or
Mm-hmm.
spreading out, and no one really listens to the activists that have been, you know, pleading to decarcerate. And you know, that's just one thing. And then the actual like healthcare, you know, which most people don't know, and I certainly didn't know that, like it's the only, you know, ironically the only people in the US that have, you know, mandated healthcare by
Mm-hmm.
law, that we have to provide them with healthcare. But that really just means like, in practice, what's that become is what that has become is like a race to the bottom of like how little can we provide them,
Mm-hmm.
and like how shitty of healthcare can we provide them with, um, and not like be liable legally, because that's going to be more costly than giving them healthcare. And like I will caveat that by saying like there is like actually amazing people that work in these institutions and try to provide great, you know, healthcare. Like you know, I know of people that I read about that work on like Rikers Island, which is a notoriously just like violent and awful place that needs, you know, it is hopefully being shut down soon. But
Yeah. But it's a
um,
losing battle. Like they
right,
can work as hard
and
as they can, but
yeah, and it's again like right, like you can't make an institution that is inherently, its purpose is to be violent, its purpose is to like cage human beings and, you know, put people we deem unresolvable behind bars. Like you can't make that institution into something it can't be, right?
yeah.
So like as far as reforming, you can't reform something that is at its, you know, core evil and destructive, in the same way you can't reform policing, because policing's role, right, is controlling,
Mm-hmm.
and violence is really their only tool.
Yes,
um,
for sure.
and I think more people are seeing that, just even with the protests now, which is great in a kind of weird way. But um, yeah, and so, you know, with the healthcare, um, yeah, I think like I was honestly also shocked by this, which maybe I shouldn't be, because you know, as you talked about on this show with, you know, Medicare for all and just our healthcare system being an absolute shit show. You know, we spend a tremendous amount of money. We have the worst health outcomes out of any advanced country. So maybe I shouldn't be like surprised that we treat people in prison poorly when it comes to health. But you know, the one thing is the burden of disease is so high. Like chronic disease is just through the roof in these institutions. History of like trauma through the roof, which
Mm-hmm.
exacerbates all of these things. Mental health, you know, at least 50% of people in prisons have like a mental health condition. At least a quarter of them have, um, you know, what would be deemed like a serious mental health condition. Or at least 50% of people have at least one substance use disorder. Um, and so, you know, there's a lot of disease burden. And you know, the healthcare is not great. That's just, I guess, you know, it to put it simply, oftentimes people are not, you know, getting the medicines they need. You know, for substance use, like specifically, you know, we're in the middle of what people call like the opioid epidemic. So, you know, one thing that people come behind bars, you know, they're incarcerated and they might have a opioid use disorder. And you know, oftentimes these institutions are not, you know, more often than not, the vast majority of them are not providing them with, you know, one of the evidence-based treatments for opioid use disorder, which is like, I mean, it's medically negligent, it's inhumane.
Mm-hmm.
You know, they could be giving them buprenorphine, could be giving them methadone, and they don't. And that's why, you know, within 2 weeks of leaving jail, the chance of overdosing because of the change in your tolerance is over 100 times higher, from an opioid overdose for those individuals.
Mm-hmm.
Um, and that's
Compared to
just,
other countries that have like supervised use centers that haven't had
yeah,
a overdose death in decades or like 16 years or something like that.
yeah. So that's like really, I think, a good like microcosm example of just like how these institutions meet violence with violence and
Mm-hmm.
like harm with harm. And
Mm-hmm.
yeah.
Yeah, that makes sense. Um, we interviewed. Do you know who Reality Winner is? She was a whistleblower. But yeah, we interviewed Reality Winner's mom, and she like because of the medical negligence, and even the prison that they are in is for women who have like medical needs. It's in Carville, Texas, but yeah, I mean they requested I think in like February or March to like compassionate release because uh, of all, I don't know, everybody in that prison has like pre-existing medical conditions. Um, and that was met with just like nothing. I don't know, she was not granted compassionate release, which I guess was probably like a long shot kind of, but one of her roommates got COVID. They didn't like separate them. She got COVID. When she found out that she got COVID, one of the guards like congratulated her, and it's just a lot of like really not. There's no rehabilitation happening there. It doesn't even seem like there's like a lot of like kindness or empathy
Yeah.
at all.
I mean, there's not really, yeah, it's not, they're not built to do that. And so it's not surprising, right? And like, coronavirus itself is a whole nother,
Mm-hmm.
topic, but it's been running rampant in jails. Like most of the highly concentrated areas in the entire country are all essentially within, prisons and jails. And like, I remember, back in, the end of February, even beginning of, March, people just pleading with government officials, just, decarcerate, decarcerate. A lot of hashtags like, decarcerate for public health, like all these other things. And it's just been very, very, very minimal, to the point where like even some prisons in California, they're touting like, we, let X amount of people out, and they're, technically still over 100% capacity. So it's just embarrassing. And like, a lot of states are not mandating that even, correctional, staff wear masks and do this and that. So there's, the people are still being transported from prison to prison without being tested, and basically spreading it from facility to facility, on, planes, trains, all these things. Like just a total disregard and lack of, care. And, it's affecting also the workers, that work in these
Mm-hmm.
prisons and jails. And, yeah, I mean, it's just unbelievable. Like people are still being detained, pre-trial,
Mm-hmm.
um, not convicted of anything in jails. Like every day in the U.S., we have over 500,000 people sitting behind bars without a conviction because they're too poor to pay bail. Um, and now people are doing the same thing with the risk of essentially dying without
Mm-hmm.
having committed, or been convicted of any crime. Um, and just based on the fact that the vast majority of people are arrested and go to jail for, really stupid shit that like probably shouldn't be a crime. It's I mean, it's just such an indictment of the entire system and just of our country, and how we, treat people that are vulnerable and end up interacting with police.
Yeah.
So
And that's not
I
even
think
to
like,
mention solitary, which is like inhumane also, and has been, I think, used a lot to deal with coronavirus pretty unsuccessfully.
yeah, yeah. So like there's some research that showed they've, like, it's increased, essentially its use has increased by over like 500%.
Mm.
Um, and like, just briefly on solitary, like that's kind of been our main way, because we're so ill-equipped to, help people with what they need, of dealing with especially people in like mental health crises. And like, there's, many, many stories of people just being thrown in solitary and dying, whether it's from, going through a withdrawal, by suicide, like all these other ways. And over 1,000 people are dying every year annually in jails. Similar to the amount of people that are killed by cops in the street. So it's just an unbelievable amount of people that are treated inhumanely. And we break international, regulations and law all the time with, solitary confinement. It's recommended. There's X amount of days you're supposed to ever humanely have anyone behind there, which really should be zero. But based on like Nelson Mandela laws and stuff, it's supposed to be, I think, like 14 days or something. You'll have to Google it, but people are kept in there still all the time, like longer than that. And like, we have the awesome American invention of the supermax prison, which is just like, rampant and, just blatant torture and other things like that, which is pretty disturbing, but happens every day here in the U.S. still.
Um, can we talk about how like unequally enforced this everything is, and how that's like not an accident, I guess.
Yeah, yeah, I think, yeah, definitely.
Okay.
So I think one way, just like to answer that question. would be obviously like the racial disparities like in prisons and jails,
Hmm.
if that's what you're getting
Yeah.
at least partially. And there's a lot of literature on this, and I know like Prison Policy Initiative has a lot of great like graphics to go through that makes all this stuff easier to visualize. But basically at any possible interaction, and there's another good book by Mark Howard, who's like a Georgetown professor, that just talks about how cruel we are in the U.S. and not only do we have like more people behind bars than any country, including like any country you can name, right? Like Russia, places you would
Hmm.
assume have like a shit ton of people in prison. Um, but like at any stage we're like more cruel. Like our sentences are longer, less people get parole, more people are on probation. Like is just our net is continually growing, um, as we continually try to like reform these institutions. But oftentimes what that does is just widen the net and create more problems and more people enmeshed in this like inhumane institution. And you know as far as like the racial disparities, um, I think, right now, maybe about like 13, 14, 15% people in the US are Black Americans. And, you know, around like, I would say 40%, I think, in like state prisons are African American. And so it's been like that ever since prisons have, existed, right? There's always
Hmm.
been disparities, but even more so if you look at every single possible like pathway of from your first interaction with the police officer, right? Like a black person or another person of color is more likely to interact with the police.
Hmm.
And then secondly, they're more like likely to then be arrested and then to be charged with a crime and then to be like held pre-trial and then to be sentenced for the same thing to a longer amount of time and then more likely or rather less likely to be granted parole.
Hmm.
So really along any stage, our criminal justice system is racist and it can never be like divorced from race in America. Those two things are so intimately intertwined. Um, I mean, like I think it's pretty well documented, and there's tons of books and a lot of people talking about it now when people are trying to learn more about the police. But modern American policing um, pretty directly developed out of slave patrols, and
Hmm.
then after that into the one exception in the 13th Amendment of like cruel and unusual punishment for people that have been convicted.
Yeah.
And we won't go a ton into like a history lesson, but there's great books that describe all this in detail. But and then with all of convict leasing, and then obviously you have like Jim Crow, which just like state sanctioned white supremacist violence was just condoned either passively or actively by law enforcement in the past, right? And like um, not much has changed since then. Um, so it's in some ways policing is just as problematic now, if not more so than it was back then.
Hmm. Um, do you remember when that Ted Yoho guy yelled at or said something to AOC? They called
Yeah.
her disgusting for, I think it was for saying that like poverty and like economic and racial inequality are what drives crime or is a driver crime.
Hmm.
But yeah, and like policing and criminalizing do that also. I don't know. Just I don't know. I don't know why he like reacted so viscerally to that. Like he was so mad that he like took it so personally. I think because he had like been poor before and didn't commit any crimes, and it's like I think that was what he was so mad about. But it's just like it's not about you, man. Like it's about the system.
Yeah, I don't exactly remember what he did that for, but that may have been it. But obviously that's like ridiculous on a lot of levels. And I think it's also again like, you know, one of the frustrating things about like, healthcare providers and their inability to like, you know, understand or advocate around their system is that, we're very data driven, we're very evidence driven. Like people in a hospital could tell you like the stupidest like percentage from some like stupid study, but like they're not willing to like understand the empirical data behind like the facts that like you're exactly saying. There's this really great book called Until We Reckon by Daniel Sered, who, and sorry if I mispronounced that, but, and, she basically founded Common Justice in New York, which is an alternative to essentially, criminal prosecution for like violent crime and violence. And it's a way of addressing it with like actual accountable based processes that are survivor centered. And in her book, she talks a lot about what drives violence, and just the simple fact that almost without a doubt, every single person that perpetrates violence was themselves like a victim, right? So like, what did we do the first time when these people were victims? Like, did we do anything to provide for their needs? Which is, you know, one of the biggest indictments on our criminal punishment system right now, is that all it's solely focused with one question, like, let's punish this person or let's not punish this person. And like, it doesn't give a shit about like the victim. It doesn't give them anything. It doesn't help. It doesn't it doesn't prevent future harm. It doesn't really do anything useful. And you know she talks, like I was saying, a lot about like the fact that poverty, drives violence and drives certain types of harm, like inequity drives certain types of harm, like shame and isolation, like all these things of people that have dealt with very traumatic lives, often, trauma imposed on them by the state. Um, and, all these things drive violence. Violence drives violence, right? So, like, obviously, the idea of incarcerating people in like these inhumane cages, treated, by correctional officers as essentially like animals, right? Like they're treated terribly. They're given like terrible food, terrible healthcare, exploited with costs, exploited with labor, sent to like fight fires in California for $1. Um, and it goes on and on, right? Like that, some states don't even pay for labor, and like the exploitation financially is just unbelievable. But um, I don't think that's really the best or only argument to like decarcerate. I think like just being a human being that cares about people and reducing harm is probably more important. But
Yeah, because all those
all of
people
these,
are their friends and parents and grandparents and siblings
yeah,
and valued community members that we would like back. At
yeah,
least
and
that's
like,
kind of, yeah. That's how we framed it in when we were talking about like the war on drugs, and just like we want those people back. But like this is the same thing. It's just a different. I don't know.
yeah, and I think we kind of touched on something that is important, and something that I've really had to kind of like do a lot of unlearning and relearning, which is kind of a lot with these concepts, because I think we all come with a lot of preconceived notions. But this idea and like abolition and kind of like the unit of analysis is like not crime. Like crime is like a political construct, right? Like crime is whatever like the state says that it is, which often like a lot of crime doesn't hurt or cause harm to
Yeah, there's
anybody,
no
right?
victim.
Like some people like steal food because they're like fucking hungry, right? Which is like the state's fault and policy decisions. So like, yeah, so like harm is really the important unit of analysis, because that also drives the questions of like who was harmed, and like how do we repair that harm, and then importantly like how do we prevent that harm, instead of like crime and criminal and like all these things that are just totally unhelpful labels. um and like, yeah, I think like one simple reform is just to like decriminalize a lot of things, because a lot of things that we criminalize don't hurt anybody, and then we end up enmeshing people in these terribly violent and oppressive institutions. And what actually causes harm in that case is the police, is the prison, and it's not substance use, it's not like sex work, it's not all these things that whether it's to control poor people and minorities or LGBTQ populations, all whatever it is, right? Like there's a lot of bad reasons that we criminalize a lot of things, but it's not helpful, and it's really just driving harm.
Yeah. Um, okay, we talk a lot of shit about Republicans on this podcast, obviously, but I think there are people on. I think even there are like some Democrats who benefit in Congress now from, I don't know, but like it just seems like so a lot of people, a lot of Americans especially, are so like horny for capitalism. Like they love capitalism and the free market. And in instances like this, like profit should not be the goal. Like justice and rehabilitation should be the goal, like you're saying. Um, so
Yeah.
yeah, so I mean, it's legal slavery, and yeah, they're being exploited for their labor, and I think anybody who is like interested in continuing the status quo is has the just their idea of this all wrong.
Yeah, I think yeah, that's a great point. And like, you know, I think it's easy to throw rocks at Republicans because they just are so blatantly like
Mm-hmm.
out there sometimes, and embracing shit that is destructive. But like, as far as mass incarceration goes and policing and prisons, it's really honestly been a competition of like who can be like tougher on law and
Mm-hmm.
order. So like, which is obviously right now with like Biden, right? Like all of these laws were a bipartisan like creation, and like a lot of that, back to your episode on like on the war on drugs, and then like truth in sentencing laws and mandatory minimums and three strikes laws, and the shredding of like social safety net. Like this was totally
Mm-hmm.
bipartisan, um, and like the omnibus crime bill, obviously, which Biden loved and kind of still loves. Like yeah, there's not many people in conventional power right now in Congress that I think are incorporating this analysis, because I think the political risk, it just seems their calculations is not worth it, because so many people buy into the same myths of like safety and
Mm-hmm.
crime
Mm-hmm.
and law and order, that it's just funny, right? Like just look around you, like look at the evidence of where that's gotten us. Like we should be the safest country in the world by far, right? Like we have the most policing, the most prisons, and like we're not, right? And like just yeah, it's just crazy how that goes. But
Um. Okay. Do you want to start talking about like alternatives, like um,
yeah,
I don't know
sure.
what else. What else do you want to make sure that we touch on
Yeah, I
that we
think
haven't gotten
there's
to yet?
there's always a lot to talk about. But and I jump around a lot.
That's
I
okay.
my yeah.
What do you want to talk about now? What do you think
We can
makes
talk.
most sense?
Let's talk about alternatives or different solutions.
Okay.
Um, yeah,
What are I don't know. I guess if you had the power to change it like tomorrow, like what would you put in place instead?
yeah. I think we've touched on some of it, and some of it is like doing like things that already exist, and amplifying that. Whether that's like harm reduction things for like substance use disorders, meaning needle exchanges, safe injection sites, like free, widely available Narcan, like all of those things. Um, and then just like the mass decriminalization of like poverty, of like substance use, of all those things. Like we could do those things in like an instant, right? Like
Mm-hmm.
we could actually reduce a lot of harm very
Mm-hmm.
quickly. um, and then you know the other part is kind of as far as like abolition goes and getting rid of prisons and jails, you know we also could do that rather quickly, right? Like I don't think I think people misunderstand about like abolition, and think maybe people are just like idealistic, but like obviously people know like harm will happen and harm always happens. Like people are human beings, and so like what do we want to do with it when harm happens next time?
Mm-hmm.
And right now, what we're doing is like basically saying, do you want to punish someone or not? And like, do you want to continue to drive cycles of violence? And so what we can do instead is, first of all, like get rid of police, because like they're just not helping. I just don't really know in what credible way like they are helping.
Mm-hmm.
Um, and I think what people really struggle with is like what do you do with the murderers and the rapists? And like it's just honestly like that's one of the biggest arguments like for abolition to me, because if you look what is happening, like not only are police murderers and rapists, frankly, but they don't do a very good job at doing what people really want them to do. Like they
Mm-hmm.
barely solve murders, right? Like
Mm-hmm.
the majority of people, over 50% of people, especially in cities, are literally getting away with murder, right?
Mm-hmm.
And so why don't we answer the questions of like, why are people killing people? Like, what is driving these situations, and how do we prevent that to happen in the future? And like literally, I think it's less than 1% of sexual assaults
Yeah.
actually result in an arrest where someone is charged.
Yeah.
Um, and that's, again, not to say all of the sexual violence that's happening in the institutions, in the carceral institutions.
Mm-hmm.
So really, what do we do instead, right? Like a lot of it has to do with transforming the relationships that we have with each other, right? Like what do I do if I have a friend that's in some sort of crisis or mental health crisis, or is dealing in a relationship where domestic violence is occurring, right? Like how do we intervene in ways that don't like exacerbate the problems, and how do we like transform relationships to actually like meet people's needs? And some of that is like large policy based, right? Like alleviating poverty would help a lot with people's a lot of the decisions people have to make, right? Frankly, a
Mm-hmm.
lot of the options that are available, paying a living wage would help as well. Like, so there's
Mm-hmm.
policy based solutions, and then there's kind of community based solutions. And again, it's like, who do we send when something's going wrong? And that should not be the police, right? Like, and that's something that exists in other places now. Like, I think one of the main referred to methods is this like cahoots organization in Oregon,
Oh,
and
I
they've been
haven't heard
around
of
for a
that.
little while. And they basically are a mental health crisis response team, and I think also for people that are struggling with other things, whether it's like houselessness or substance use. And like they go with trained people who know how to do these things, and like
Mm-hmm.
without weapons. And like that's a big question going forward, is like, so what do we should replicate that in cities, but obviously the police are they want to be involved in anything, and they want more money and more funding, and
Mm-hmm.
they want to be a part of that. But like, you should say no, right? Like, we can do all these things without them. Like, we don't need law enforcement officers with guns
Mm-hmm.
to solve these problems. um, and so like that's one small example, right, of just like a response to things that are going wrong, because harm will always happen, or people will always have needs, right?
Mm-hmm.
Like, people always have needs, and I guess someone having needs is not harming anyone.
Yeah.
So right. And then yeah, and then for me, like, why, again, like kind of coming full circle, why I became so interested in this is like I see Medicare for all, or rather just like a just nonprofit driven human based, right, patient centered healthcare
Mm-hmm.
system as like a massive driver for systemic change. Meaning that, like, obviously the training of like mental health providers is something that we need. And we need like hundreds of thousands more of them. We need like
Mm-hmm.
hundreds of thousands more nurses, hundreds of thousands more physicians. And so like developing infrastructure for that is like not easy, but like what we could create instead is much better. And the funds obviously exist, right? Like, we spend a minimum
Yeah.
of $180 billion on policing and caging people. um, so like it's
Wait,
certainly
I want
there.
to go find. I wrote down the specific amount for people over the age of 50 or something. No, I'm not gonna be able to find it. But it was something crazy. Oh. $16 billion annually caging people over 50 years old.
Yeah,
Why?
yeah, yeah, it's pretty insane. And the fact that like anyone's still in a carceral institution with coronavirus and that's over 50 years old right now is like medically negligent and a
Yeah.
crime. But yeah. So yeah, I think the alternatives question is hard, because it's also, you know it's not to center like the policing and prisons, and like, right, like how can we like add something additional, or like how can we make them better? Like, the question is never like, how do we make a prison or a police officer better? And I think that is where right now, like, especially people new to the conversation get off track of what could truly be transformational, because everything's revolving around, well, let's do community review board, let's do
Yeah.
cameras, let's do this and that. And like,
Why?
critical resistance has an analysis that I appreciate for this, and they talk a lot about reformist reforms being those that we're talking about, and then abolitionist reforms, or abolition reforms. And I think there's a few questions that they ask which are honestly really easy. And so like the one being like, does this reduce the funding for the police? And a lot of these don't, right? Like when you're giving them more technology, that is giving them more funding, and
It's
will not
not
do anything.
working.
Like pretty much every reform that is being tried out has already been tried in many places, right? And it's, I think incredibly frustrating to people who have been organizing and doing the work for, decades, to see this mass, uprising, and people being interested and wanting to learn, but then, having something come up like the 8 Can't Wait campaign, which, like, to be honest, is just like kind of incredibly damaging and like deflating, because now people who are new to this are grasping onto this idea of like we can make big change if people pass these laws, which was and still is kind of utter bullshit, right? Like, and that's also to say like the goal should not be to reduce like police killings by like 50% and have 500 people die a year, right? Like it should be
the number we're okay with.
zero. Like it should be zero. It should always be zero. And like, and we need to find a way to get there. And like the best way to get there is probably to have no police, right? Because I don't think that it's capable otherwise. And other questions to ask is basically like, does this new reform or like alternative like challenge the notion that police keep us safe, which is to say like, sending a social worker and a trained mental health provider probably challenge that notion and say like we don't need policing to help us, and they don't. And then another question would be like, does this reduce the tools, tactics, and technology available to them, which you always should, because you could see it now during the protests, right? Like the incredible amount of like surveillance that the police use is pretty striking and incredible against their own citizens. And then again, just simply like, does this reduce like the scale of the policing? So like easy example, like a law reform, right? Like let's decriminalize these things so that they literally have no reason to do that, right? So there's a lot of, there's a lot of reforms that would reduce a lot of harm, simply just by like lessening the interactions between police and people.
Yeah. Did we talk about how much do you in like medical school? How much do they bring up like generational trauma and like adverse childhood experiences and stuff? Like you mentioned that a little bit earlier, right? Is that something that you like came to on your own, or is that something you talked about in school?
Yeah, I think it's something that is not taught well in medical school, and it's something that I'm also somewhat new to, but I think is incredibly important. And something I'm trying to actively learn about more. But it's this, I'll partially, this idea of like ACEs and like adverse childhood experiences, and that those just drive all sorts of like chronic disease as you age. Shortens your life expectancy, and a lot of the average childhood experiences also have to do with obviously like your parenting, like whether you were like physically sexually abused, whether like your parents were struggling with right, like so all these things, and like and all of those problems that are driving ACEs for children, which is to say all that's driving their worst health in the future, are intimately and they're intimately related to all of our carceral institutions, right? Like our solution to mental health is like to basically not having enough providers, to not having infrastructure, to mental health stigmatization is put them in jail. Like for substance use is put them in jail. And like that again is just talking about the collateral consequences, which like are impossible to, tally up. They're just so extraordinarily high, right? Of families, of children, of the generational trauma that's just going to continue to happen until we've removed these institutions from allowing that to happen, right? Like there's just so many better ways to spend hundreds of billions of dollars. And again, I don't think that's like, it's not really a financial argument, right? Like I don't believe people should make money from carceral institutions. I think like it's totally amoral for private equity firms to be invested in this. I think it's immoral to have private healthcare providers profiting off of people being in cages. But that's not to say that like we don't need this money, right? Like we need a massive amount of investment to improve and create equitable healthcare, to improve and create equitable education, right? Like we need this money. We just need to actually use it in a way that's like life affirming and enabling well-being, instead of destructive and for the profit of few, right?
Yeah, and a lot of the cost is because we have like a decentralized medical system, like it would just be so much more efficient if it was centralized.
To briefly mention again, like Common Justice in New York, and I think like everyone should read her book Until We Reckon, and a lot of other books. But basically their kind of mantra, for lack of a better term, is the way they approach violence is with like 4 main tenets of being like survivor centered, accountability based, safety driven, and racially equitable. And I think that's just a good framework for like all of these quote unquote like alternatives and solutions. And what they use could probably be considered like a restorative justice framework. And I think this is like a whole huge topic to like get into about like what does it look like with like restorative justice, which is a totally like reasonable alternative to incarceration and something that we need to like replicate locally on a massive scale. And then there's other principles like transformative justice as well, that's used and has been used throughout the country with different organizations like Generation 5 and many others. That I kind of referred to in that paper that only you and my brother have read, but
I bookmarked it.
Yeah, but so those are like 2 examples of like a way of basically answering the question of like, how do we actually meet survivors' needs? How do we have a process that's actually accountability based, which is not to say like holding people accountable, which is a stupid phrase and we should all lose it, right? Like you don't hold people accountable. Like accountability is like an intrinsic process, right? And a lot of that has to do with like, I'm recognizing that I caused harm to you, and like, how do I like make that harm better? And then like the most important step, which is probably what our system is worst at, which is hard to say because it's really bad at being survivor centered as well. But like the idea of like preventing it from occurring in the future, right? Like, and when you look at like the surveys of like survivors of violence, right? Like they like overwhelmingly every single one is like, I don't want this to happen again to me or to someone else. And that's not what our system is set up to do. And so like these other, frameworks of like transformative justice, restorative justice can actually like help do that, right? And can actually like allow people to like live safely and not just like securely. And like, I think that's super important to think about, and just to shift our perspective of like, what is accountability? And like, yeah, and then obviously with all of this, like to also just shift what we view as like justice, and like that justice is not punishment, and there's a lot of ways that we can find meaning and injustice and repair for harm that is not simply putting someone in a cage. And so I think like it's never going to be part of the problem with our current institution is that we're using a kind of a one size fits all for literally like anything you can imagine, right? Like we're like, oh, you did this wrong, or you committed this crime, like, okay, go to jail or do this, right? Like, and that's a stupid way to do anything. And so like, Miriam Kaba talks about this, and she just says that, we need a million solutions, and like everyone needs to, do this based on your even local culture, your local, who you live with, who you're in community with. And like, even within like a transformative justice framework or a restorative justice framework or a violence prevention framework, which are a lot of great, work that's done in a lot of cities, like in Chicago, with like Cure Violence and other things like that. Like these will all look different in different places, and they should, right? Like, because people and places are different, and even situations in the same place are different. And so everyone can be a part of that, like building something new and different, which is kind of exciting. And what I think is inspiring about abolition and the people that do this work, they're just fighting against so much like, stigma and misinformation and with no like fucking funding, and all these things, right? So like for people like me who something I can do is just like give them money, right? Like coming from a place of privilege and having money, like supporting these people that are doing the work every single day, that are actually like meeting people's needs right now with like mutual aid during coronavirus, because our government isn't. Like they're like actually doing what like a lot of people like to talk about or like to theorize, right? And I think everyone should be inspired by that and should learn more about it and should figure out what's happening where they live. another one being, mutual aid funds, and then like bail funds, right? Like a way you can help someone that's, enmeshed in this violent institution is to get them out of it, right? And
Yeah.
people can't afford bail, so bail funds are necessary until we change the laws.
Yeah. I know, based on personal experience, that when you talk about donating to bail funds, that people talk about, well, one, if you're talking about it in terms of the Black Lives Matter protests, they talk about how you're bailing out looters. And then, well, I guess, I don't know, I guess that argument is probably the same, but just, it's such like a, I don't know, it's just such a screwed up, racist by design system that, I don't know, that it should, I don't know, that,
Yeah.
those
Yeah, I
things
mean,
should be supported.
I think there's, and it's all just about like education, right? And a lack of education,
Yeah.
and this idea that like cages keep us safe, right? And like keep who safe from who, right? And like this again, you can't divorce these systems from racism and the painting of, right, like black criminality in the U.S. And there's no evidence that like holding people pre-trial increases safety, right?
Yes.
And like what you're doing is you're paying billions of dollars and like exposing these people to inordinate amount of violence, potentially making them lose their job, which happens all the time, right? Like maybe they are now having to pay for childcare, or like, right, there's just a million like collateral consequences to making someone wait in jail to probably not be charged with anything. And like we said, people are dying every single day in our jails, and like to put someone there because they can't afford to leave is just ludicrous. And it's really discouraging, again, talking about like bipartisan support for things that matter. Like New York City and New York State rather, like was rolling back. They actually made some progress and like bail reform, and then they started to roll it back just because of fear mongering and just racist.
There's so much disinformation,
and it's really easy to scare someone. And this kind of goes all the way back to the campaign. I think the most like infamous example of this is someone that was released from prison, like Willie Horton, right?
Yeah.
And he went and he committed a crime, right? And so we just shouldn't be building any institution based on exceptions, right? And like people are like, well, we need to put 2.3 million people in cages because there might be like one serial killer.
Yeah.
Like, well, it's like that just is like stupid on so many levels,
You're
right?
derailing
And like
the conversation in like,
right. And I do understand, right? Like, I mean, like people, like violence is serious and like people are harmed, right? And like, but I think that's why abolition is important, and that's why these frameworks are important, because we're actually talking about like survivor centered solutions that will actually provide for people. Like our institutions do not like provide anyone with like mental health care. They don't provide like, frankly, anything. Most people don't get to actually be heard because everything is done in a plea deal, right? Like it doesn't provide anything for them. And it also doesn't make people safer, right? Because it's just driving violence. And again, like over 95% of people are coming out of these institutions. So like, is that really what you wanted to do? Send someone to a violent place that is, possibly going to make them a, worse or more traumatized individual, right? Like there's stories of, very, just like, I don't know, for the lack of a better term, like normal people, right, going in and coming out like in like white supremacist gangs, right? Because that's what you have to do to survive these institutions.
Yeah.
So it's just not a good solution in any way. And just from a healthcare standpoint, like any like healthcare provider that supports these institutions, I think just does not understand what they represent and what they do and how they exacerbate inequality. And I think that's a huge lack of education on our part in the medical system.
Yeah. So what actions, like, are there any politicians who are calling for abolition, or what's the closest thing, or like who can we support, or what can we try, what can we do?
Yeah, I think it's hard, especially on the federal level. And I think it kind of points to a bigger point, is that like all your actions and efforts should be as local as possible, whether it's in elections, whether it's in donating to politicians or donating to, mutual aid bail funds, to community organizations that are preventing violence, that are using alternatives, that are sending other people other than cops. One of the simplest things you could do is just like really don't call the cops on people. And then, yeah, donate to people that are going to actually be supporting things that will make things better. I think the federal legislation that's being supported by very, very few people is, the Let Us Breathe Act, I think is what it is, by Movement for Black Lives. And so you can go and read that. And I think it just provides kind of a framework for what it looks like to actually invest in things that would be abolition reforms. And then obviously, like, for myself as well, just continued education and reading from the people that are actually stakeholders. You know, getting involved if you have time to whatever local organization that you can, but being familiar with people like Angela Davis. I mean, reading even like Keeanga-Yamahtta Taylor, Princeton professor. There's another great book called Prisons by Any Other Name, by Meyer Schwenoir and Victoria Law. And I mean, there's other people's names I don't think we've mentioned yet, but like Beth Ritchie, Dean Spade, like all of these people. You could go to the 8 for Abolition website and just read up on that as well, which would be, it was kind of in response to the 8 Can't Wait. And it was saying, no, here are actual reforms that will keep people safe and make people's lives better. But yeah, just peruse around like, the Black Youth Project website, Movement for Black Lives, Critical Resistance, Insight is another one. And then, whatever, I think, if you're a teacher, right, like find out who's leading the movement and what's going on with like Thompson schools, right? Like what could be funded instead and what could actually, provide for students better. If there's something else that, if really care about elderly care and things like that, like there's tons of organizations advocating for getting elderly people out of prisons, like this group called RAPP. So I think whatever niche it is, there's always something there. And then as far as just like, staying educated, you can find all of these people on Twitter, but, also just for more criminal legal system, I read The Appeal a lot. I think it's super helpful. I appreciate, a lot of their writers and what they do. The Marshall Project is great. And they also have a lot of things that are written by, formerly incarcerated people as well, which I think is super important. And then more like policy wise, you have like Prison Policy Initiative, which I mentioned earlier. They just have kind of all your statistics that you want. So if you're interested about who's in jail, where, and how many people and the costs like that, you can find all that there. If you think it's fucked up that people pay like $15 for like an hour phone call with their family member when they're probably already, impoverished, then there's, places like Worth Rises and other organizations that are trying to end that. And then, of course, election year, there's a ton of work that goes into, ending just disenfranchisement, right? Like people that, leave our institutions are disenfranchised in so many ways, whether it's through jobs, through voting. And that's a huge thing that they need support and funds and time. So yeah, I hope that kind of answered your questions.
Yeah, for sure. We usually also give like bigger picture, tangible actions for how to save like democracy now that that's on the line. And I don't know, were you on the email that your brother sent out yesterday?
That was, yeah.
That was so smart. I'm gonna try to rope him into coming on also to talk about North Carolina as like a swing state since he knows stuff about it. And I may have been there once. Not that it matters, but he put together an email. I'm gonna pull it up because it was so smart. But the other things you don't have to join. That I'm like putting you on the spot. I feel bad. I have a text banking shift tomorrow and the next day. What else am I doing? I wrote 20 more letters to Pennsylvania, swing voters in Pennsylvania. And then what Scott did was like create an accountability like tree on email and like committed to doing, I think he said like 70 hours of volunteer work between now and the election. And
Yeah.
for every hour that he falls short, he was going to donate $50 to um, something cool. I forget. But that was, I don't know, that is just such a good idea. And it's like very creative. And like I said at the beginning, it doesn't really matter. I mean, it matters what you're doing, but like we're 2 months from the election now, so do something, whatever it was. If you want, I don't know, more information on like starting an email tree with your, I don't know, like 5, 10, 15 closest friends, um, I'm I will send you Scott's, and maybe I'll ask permission first. Um, but yeah, is there anything else that like you are, I don't know, getting up to now that the election is getting nearer?
Uh, I mean, I think primarily due to lack of time, it's mostly just trying to find the right places to um, send donations and like be accountable to like keep sending donations.
For sure.
Um,
I That's a good point. And you were mentioning earlier that it is so important to do stuff at a local level. Um, it's really easy to find good local candidates in your state through sister district or through what's it called? Future Now, Future Now Fund. Um, they have just it's they're really good local candidates that are in like your state houses, which is where a lot of actual decisions get made and politics happen.
yeah, I think kind of related, and not to go down another rabbit hole, but local elections for people like DAs and like sheriffs and like
Oh
people
yeah,
that
good
you
point.
probably never thought about hold like such disproportionate power like in these systems, and
Mm-hmm.
that a couple hundred votes can like change those elections in
Yeah,
certain places. So yeah, you should read up on that, and the appeal is great for that as well.
the appeal. Okay, cool. We will also do one of our next. I will probably get my ballot in about a month, probably a little bit less. And we're gonna do a whole episode of like going through that and like what the thinking is at each elected official, and like what you would want, what you would want to avoid, and
Yeah,
stuff like
that's
that. But
super
yeah, that's
cool.
a great point that those are, yeah, they hold a crazy amount of power, and they can
Yeah,
either like people. It's just like astounding how the sheriff where I used to live like has so much power, and he says the most racist shit on Twitter, and I'm like guarantee he can't explain what like trauma informed care is or like anything like that, and it's just, I don't know, it's just so
yeah,
sad. So yes, do your research, and we will like help you with uh thinking as you like go through your ballot too if you have, because who knows what a comptroller is. I still don't.
yeah. I think like yeah, just looking to the people that are directly affected by these systems, if we're talking about like, prison industrial complex or whatever, right? Like economic policy, all these things. They usually all have, recommendations and have been asking for things for like decades and decades. So
Mm-hmm.
we could like support that. It's peace of mind that we don't have to like figure
Yeah,
everything out from scratch. These people are doing,
yeah, they hold a crazy amount of power, and they can
yeah,
either like people. It's just like astounding how the sheriff where I used to live like has so much power, and he says the most racist shit on Twitter, and I'm like guarantee he can't explain what like trauma informed care is or like anything like that, and it's just, I don't know, it's just so
yeah,
sad. So yes, do your research, and we will like help you with uh thinking as you like go through your ballot too if you have, because who knows what a comptroller is. I still don't.
yeah. I think like, yeah, just looking to the people that are directly affected by these systems, if we're talking about, like, prison industrial complex or whatever, right? Like economic policy, all these things. They usually all have, recommendations and have been asking for things for like decades and decades. So
Mm-hmm.
we could like support that. It's peace of mind that we don't have to like figure
Yeah,
everything out from scratch. These people are doing this work, and we need to be careful not to like fall into the hole of like reformist reforms, or supporting something that sounds good, like a drug court instead of putting someone in a cage, which maybe sounds better, but like in reality is not the solution that we're actually looking for.
Mm-hmm.
So yeah, things like that.
For sure.
And I think the last kind of recommendation, because it touches on a lot of the topics that we talked about, just the website transformharm.org will have a lot of information for like the concepts even of like restorative justice, transformative justice, and things like that. But yeah.
Transform harm, is that what you said?
Yeah.
No. Yes. Okay.
.org.
Awesome. Anything else that we didn't cover yet that you want to make sure that we touch on before we sign off?
I think we covered a lot.
Yes.
And jumped around quite a bit, but that's okay.
Okay. Then usually we end with like a fucking hooray or just like some positive thing. Do you have anything? I've had like 6 amazing peaches this week. Like just every day this week. And I know it's pretty minor, but right now, like that's what I got going on. I had 6 perfect peaches. And it really like made my day every day. But yours can be more like impactful than that or less. Like, do you have anything
No, that's
positive
pretty.
going on?
I mean, that's pretty big, and I
I
appreciate
agree.
that. Living in Georgia right now, so I appreciate a good peach. But
Right.
no, nothing really too big. I'm on vacation, so that's kind of the big
Oh,
thing I'm thankful for right now. But yeah,
that is cool. Did
for
you
one
go
more day.
anywhere?
But yeah, I did. I went to Louisville.
Oh,
Yeah,
Louisville.
yeah.
Nice. Was it fun?
It was fun. Yeah, it was great. Mm-hmm.
Nice. I feel bad because Morgan is supposed to be on a vacation right now, and I think she's not. Well, thank you very much, Mark, for joining us today. I learned a ton from you, and I'm really looking forward to reading some of those books and looking at some of those resources that you talked about. But thank you so much for joining us.
Yeah, thanks so much for having me.
Thank you guys so much for listening to For Your Misinformation. If you haven't already, please subscribe to the podcast, and if you like it, give us a rating and a review. It helps us find more listeners, and the more of us there are, the better.
And make sure you're following along on Instagram and Twitter at FYMI Pod.
Shout out to Kyle Dibdahl for the intro and outro music, Hope Dye for the podcast art, and Ben Schlofelt for the audio production.
We come out with new episodes every Monday.